September is Gynecological Cancer Awareness Month, which aims to raise awareness about the several different cancers women can be diagnosed with, including ovarian, cervical, uterine, and endometrial cancer.
According to the American Cancer Society, over 417,000 cases of endometrial cancer worldwide were diagnosed in 2020. Back in the studio with us today to answer some of the questions about it is Dr. Stephanie Hack. And good evening, Dr. Stephanie Hack. Thanks for joining us again.
Good evening. Thanks for having me.
So the very first question we want to ask you, what is endometrial cancer?
Yes. So in the uterus, there's a lining, and that's the lining that women typically shed every month with their period. That tissue is called endometrium, and that is where endometrial cancer begins.
And how would a woman actually know if something is going wrong there? What are some of those symptoms that she might be feeling?
Sure. So the first symptom, I think the most common symptom that women experience is abnormal bleeding, which can be irregular bleeding, spotting in between the periods, postmenopausal bleeding. That is the main symptom. But then also, as it progresses, you can start to feel things like abdominal fullness as the cancer grows. You can feel pelvic pressure, pain, weight loss. Those are some other symptoms.
And then why are Black women more likely to die from this form of cancer?
Yes. So the first reason is that Black women are more likely to get the more aggressive type of the cancer. So there's a type 1 endometrial cancer that is more common and slower growing. And then there's type 2, which is more aggressive and is more likely to be diagnosed later. So that's what Black women are most likely to be diagnosed with. And then we also have the health inequities. So that's going to be racism, poverty, access to care. Black women are also often diagnosed later. Their care is delayed, and they may not receive the top treatments that many other women receive.
And to my understanding, white women are diagnosed with the cancer more. Is that correct?
That's correct. So white women are diagnosed with the cancer more, but Black women are 55% more likely to die.
Mm-hmm. Well, I know a few weeks ago we talked about endometrius, and then now we're talking about endometrial cancer. Can you just talk about the difference?
Yeah, so we talked about endometriosis when that lining that typically should be inside the uterus grows anywhere outside of the uterus or into the walls of the uterus. And so with endometrial cancer, that's when the lining of the uterus, the tissues, the cells start to grow abnormally, and they can become precancerous and develop into cancer.
Mm-hmm. So there is a direct correlation from having endometriosis and then getting endometrial cancer?
No.
Okay.
No. So those aren't related in that sense. But there are risk factors for endometrial cancer, which one is being Black, being a Black woman, but also obesity, high blood pressure, diabetes. Those are other risk factors.
Mm-hmm. And talking about the importance of us just discussing this topic, because before today, I actually never heard of endometrial cancer.
It's so important. And I think like the biggest PSA that I can give, if you've ever heard of a woman who's postmenopausal say, oh, I had some bleeding, I got my period. That could be your grandmother, your mother, your auntie, maybe for some of the viewers, them. That is not your period. Any bleeding that happens after you've gone through menopause needs to be investigated because it's very concerning for endometrial cancer, and people need to know about it, just like you said, just like you didn't know. Many, many women don't know and are thinking that this is normal, and it's not normal.
What makes endometrial cancer more dangerous for some women than others?
Sure. So it's having those risk factors that we discussed, but then also the fact that we talked about type 1 endometrial cancer and type 2 endometrial cancer. And the type 2 endometrial cancer is very aggressive. And by the time it's discovered, women are often later in the diagnosis, and the treatment that we have available isn't going to provide a full cure as it might for somebody who's caught early on in the disease.
And talk about why Black women should speak up more at the doctor's office about this topic.
Sure. So have you ever gone to the doctor and you go through the whole visit and at the end they say, do you have anything that you're concerned about? And you're just like, because maybe you forgot. It is something that we need to feel empowered to do. I think often we don't feel empowered when you're speaking with someone who's a professional and you feel like that they know everything. So having an advocate with you, writing your questions down, bringing your receipts, documenting all of your bleeding, all of your symptoms. These are all things that we need to feel empowered about so we can have that conversation so we can catch the diagnosis early.
Absolutely. Dr. Hack, thanks so much for joining us again.
Thanks for having me.
All right, for more information on women's health and Dr. Hack's podcast, visit ladypartsdoctor.com.